State lawmakers have approved a new round of COVID-paid sick leave. Workers are entitled to 40 hours of paid time off to quarantine, get a vaccine, or to care for another family member with COVID.
But this time around, there won't be any federal money to help offset the cost. Our political reporter Morgan Rynor explains how the sick leave will be covered.
Businesses with more than 25 employees will have to pay for this. Now, Assemblymember Phil Ting recognizes that this could pose as a burden to small businesses, so it's something that he's hoping to address in a future budget proposal.
All members vote.
By a vote of 55-7, supplemental paid sick leave passed the Assembly. It entitles employees to 40 hours of PTO going back to January.
Our workforce was upended amidst this surge, forcing many to work sick or to make a choice between losing their job or taking care of their health or the health of a loved one. This is not an option that people should ever have to make.
But Vice Chair of the Budget Committee, Vince Fong, said without help from the feds this time around, the cost will be troublesome.
Members, why not offset these costs with a state tax credit or exemption? The Legislative Analyst's Office provided estimates of $500 million to over $1 billion of costs borne entirely by businesses and nonprofits statewide. There is no relief provided for this.
Chair Phil Ting said he recognizes the burden.
I do want to align myself with some of the comments my vice chair made to ensure that the small businesses who definitely need financial relief get that relief. We were not able to get that into this proposal, but something that we continue to talk about. We really would love to see that in the June budget proposal.
But despite the cost concerns, the bill passed with flying colors.
And the lack of a safety net for our workforce may have contributed to over 8 million Californians testing positive for COVID-19 and more than 80,000 lives lost to the virus to date. Today's vote on this bill is one of a social and moral consciousness because COVID-19 is truly a life or death issue.
Shortly after the bill passed the Assembly, it passed in the Senate by a vote of 30-7. Now it has to go to the governor's desk. But remember that the governor helped create this bill with the legislature, so it'll be hard to imagine that he turns down his own legislation.